Today, our topic is going to be PCOS and its impact over the skin. So, what is PCOS? PCOS is polycystic ovarian syndrome or polycystic ovarian disease. It affects the women reproductive organs. It's mainly endocrinal disorder of women reproductive organ. Here, there will be excess production of testosterone hormone, and it will lead to irregular cycles as well as infertility in future, and it may lead to some ovarian cysts. So these are all diagnosed by gynecologists when a patient comes for infertility. Apart from this, it may have effect on skin also. Let us know what are all the skin effects of PCOS. PCOS, excess androgens, can cause acne on the face. It can cause some discoloration over the neck and face areas, which is known as acanthosis nigricans, which appears like ridged pigmentation, hyperpigmentation over the neck and face, and some amount of weight gain and inability to lose weight. And mainly the skin changes will be acne. So these are all the changes which we see, and it's an impact over the skin. Usually, it's a endocrinal disease or endocrinal disorder of the women reproductive system, commonly seen in adolescent and young adults, and it will result in increase in androgens. So we know androgens also have effect over excess oil production over the skin. When there is excess oil secretion in the skin and some amount of genetic factors also related to excess oil secretion, this will result in clogging of the pores. Usually acne is seen on the face, neck, chest, as well as back. So we have oil glands in the skin. These oil glands produce sebum, which is oil and dead cells and dead cells. These are all coming out of those pores which are present. The hair follicles along with pores are present over the skin. So acne we usually see on the face, back, and chest. What happens in acne is excess of androgens in the body will result in excess sebum secretion, because these glands are sensitive to the androgen hormones. So we know commonly that in PCOS, which is also one form of hormonal acne, here excess testosterone hormone will be produced. So this will result in excess sebum production. The pores of the openings over the skin gets clogged. When they get clogged, the bacteria accumulates, the dead cells, sebum, and the bacteria will result in formation of pores. Blackhead and whiteheads initially, then they will be inflamed, leading to pus due to bacteria, and red bumps will be seen over the face. So it is all the staging of acne, which we will say, which is from blackheads, whiteheads, which is initial stage, to bumps, and then cystic acne, which is more severe form. So in PCOS, we can see all forms because it is the highest, it is also a hormonal acne, and influence of testosterone will have more impact over the skin. PCOS should be treated in combination. I mean, gynecologist as well as dermatologist opinion should be taken. If there is hormonal imbalance, they should go to gynecologist. If they have irregular cycles, usually the patients come. If they come to dermatologist, we usually ask cause of acne. If it is severe, we also talk about irregular periods. If they have irregular periods in them, irregular periods, they have to be referred to a gynecologist, or even dermatologist can treat irregular cycles with birth control pills, which should contain estrogen and progesterone, so that the hormonal balance will be maintained. So this will indirectly lower the androgen hormones, and then it will have improvement of the acne as well as the cycles. So a gynecologist and dermatologist in combination should treat PCOS with acne. And if PCOS has other problems like infertility, regular cycles, etc., so gynecologist can be means we can refer to a gynecologist. Acne usually occurs when there is genetic predisposition. Adolescent and teenage and young adults will have genetic predisposition. Usually we see this acne coming in patients or parents who are having acne already, who had in their time. So genetics plays a main role. Apart from the stress, pollution, excess humidity, these are all the factors, and wrong dietary habits like taking more amount of dietary sugars, processed sugars, junk food, and inadequate water and inadequate sleep and stress added environmental pollution. And these are all the things which will precipitate an acne. So this PCOS is a little bit different, where hormonal influence is more, where excess androgens play indirectly over the acne, and it will aggravate the already predisposed individual. And it may occur in adult as adult acne also, like around 30 plus age group. You should counsel the patient that maintenance of addition, correct weight balance, exercise these, so that the hormones are maintained in balance. Okay, and if it is very severe, consult a dermatologist or gynecologist for correction of the hormonal imbalance. So lifestyle modifications are very important, reducing stress factors and adequate intake of water daily and sleep also. This will all have impact over the though we may consider these are all small things, but they have very much impact over our overall health. So apart from the prescription of birth control or pills which contain estrogen and progesterone, dietary modifications as well as lifestyle modifications are important, and exercise. So maintenance of correct weight is also important, because when there is gain in weight, there will be a condition called insulin resistance. This will add upon the overall PCOS, and it will more aggravate the symptoms and signs. So, in general, dietary modifications should be explained, lifestyle modifications should be explained, as well as prescribing some pills which will reduce the hormonal imbalance. And these are all the things. In dietary modifications, advise reduce the refined processed food intake, dairy products, excess sweets which contain sugars, junk food like which contain more amount of cheese, like that. Excess fats should be avoided, and all fried items can be avoided. And lifestyle modifications like maintenance of correct weight, introducing or practicing exercise, maybe a yoga, maybe walking, running, etc., should be practiced. And maintenance of ideal weight is very important in these patients. We should take the foods which contain anti-inflammatory agents like tomatoes, garlic, turmeric, olive oil. We should include them, kale. We should include them in our food. So the foods which are more of vegetables and fruits, okay, well balanced diet, and protein, of course, and avoid red meat. Okay, these are all dietary changes which we can advise, but there are no such home remedies which can be practiced.